Doctor, we've talked a lot about how many different conditions can be improved by a hyperbaric oxygen treatment, but it's not for everybody. Not everybody will see the same results. Everybody's different, but some people, maybe it's just not safe for them to go into a chamber. Can you explain some of the conditions or issues people might have where you would say, you know what, I just don't think that hyperbarics will be right for you or maybe not safe for you?
Sure. So with hyperbarics, we look at, are there definite contraindications or absolute contraindications or relative contraindications? So one of the absolute contraindications is an untreated pneumothorax, a collapse of a lung. Because of the pressure change that can occur with hyperbarics, if they had an untreated collapse of the lung and they're in a hyperbaric chamber, it could actually worsen that condition quite dramatically. Now, when you talk about some of the relative contraindications, it could be patients that may have claustrophobia if they go into a chamber, are so concerned about that. If they've had recent ear surgery or chest surgery, there's going to be a time frame that we want to wait before they might be able to do hyperbaric treatments. There can be certain medical conditions, such as lung condition COPD, where they have trapped air in the lungs that we really need to be cautious as far as what is the benefit versus risk with the pressure change on the lungs that could put them at increased risk. Patients that may have heart disease where they have congestive heart failure, that they're going to need a cardiac echo to see what percentage of blood flow goes through the heart, that there has to be a certain amount of blood flow through the heart to say you're safe to do hyperbarics. So we often get patients with medical conditions related to heart and lungs, and for some of those patients, I'm going to have to request that they see their specialists to make sure they are clinically safe to go into a hyperbaric chamber.
One question I get is, what about smokers? People that have smoked for many, many years, is it safe for them to go in the chamber?
For smokers, obviously, first of all, we want them to quit smoking. Because of the nicotine, the effects, it constricts blood vessels, constricts airways, so if they continue to smoke and do hyperbaric treatments, they're actually defeating the purpose of what we're trying to do to get oxygen into the body. So if they can't quit smoking, I usually ask that they not smoke for 3 hours before a treatment and 3 hours after a treatment.